ALCL is a rare lymphoma being associated with some breast implants. At the moment, it's a very rare disease. Between 1 in 30,000 to 1 in 3,000 people with implants are known to have contracted this problem. That does, in perspective, make it a very rare problem because, for example, breast cancer is something that's 1 in 8 people. The reason why we consider that to be a really important statistic, even though it's rare, is because our patients who come for implants, usually may be looking for an aesthetic improvement or a very elective procedure. We think it has multi-facets to as to the cause. It is partly to do with genetics, where certain people are more prone to that problem. It is mostly in white Caucasian populations and much less in other populations. We also think that it's to do with the type of implant that's put in. So what I'm holding up here is a textured implant, which means that it's a bit rough on the surface. Not this particular implant, but there were some others on the market that were even rougher than this, and they got associated with higher rates. We think that that's possibly due to contamination of the implant when it went in. And what that means is that the rough implants will probably capture a lot more bacteria when they're put inside the patient. It's not enough to cause an infection, but over 8 to 10 years, it grumbles along under the surface, and patients then present with a swelling of one of their breasts. That fluid around the breast implant is tested, and should it be found to be dangerous, it means that you need the implant and the scar tissue around it removed. Usually most females are then cured from the problem, but a few of those rare patients then went on to develop further problems like an actual tumor that then went somewhere else. So at Mohs Plastic Surgery, what we try and do is try and do the safest operation today. I talk my patients about using both round implants, which are smooth, and implants that are textured, which are teardrop. The way that we discuss the pros and cons is these type of implants, which are teardrop, do really well in patients who don't have a lot of volume. They are textured though, and we try and use the ones that are the absolute safest with respect to ALCL, and implants like this have a risk of 1 in 30,000 or less, which in the big scheme is actually a fairly rare problem to have. For patients who don't necessarily need that implant, we'll go with a round implant. It's smooth. It does mean that there are certain aspects of the procedure that we have to be careful with, but this imparts no risk of the ALCL problem. All our patients get some reading material about the disease, and we do ask them to really read up to be familiar with all the risks and complications that can happen, as is important for any operation.